working at the schoolhouse, training, and especially this newer, I guess, generation of medics are completely and utterly petrified of longer acting opioids like morphine or hydromorphone. So based on your experience, you're the perfect guy to talk to about this. So can you tell me just a little bit of your experience with like morphine and hydromorphone?
Well, I mean, obviously back whenever I came in, back in the beginning of the 90s, everything really was back then was morphine, morphine, morphine. The thing that wasn't around back then for people was, the ketamine and especially fentanyl, back then. And, back then it was actually very taboo kind of a thing. So everything was, pretty much morphine based, and even Dilaudid wasn't, something that you saw. It was people knew morphine, and that's pretty much what they knew. And then, later on, I was kind of the driving force with a lot of the getting people to switch over to, ketamine, especially in the trauma environment, and using that in different ways for procedures and things along those lines. And also, pushing a lot of the fentanyl, IV fentanyl, even more so than, the fentanyl lollipops. But I think, as we've talked about in the past, that, at times things start to swing almost the other way, and people start to want to throw the baby out with the bathwater, and say like, well, I can never use morphine because it's an old drug. I can never use Dilaudid because it's an older drug. And that's not the case. It's like, I always try and tell people is like, use the right tool for the right job, type of a thing. You don't want to use a hammer on a screw. You can do it. It just isn't going to turn out real great. You know what I mean? And you're going to tear a lot of stuff up. But the point being is that, everything has a place, and a time, and, getting people to realize that, because, a lot of times, we were dealt with, very limited resource environments, and maybe I don't have any more ketamine, unfortunately, and I only have morphine or Dilaudid, or maybe I'm down to something like Nubain for some reason, Demerol, even if I'm in other countries when I'm having to buy things off of the economy, type of a thing. So I think from that standpoint, and from teaching guys for, I don't know, forever, is trying to think through, here's what